Thanks for watching our podcast. Here at Spear Consulting, our services include business strategy and human resources consulting. In HR, we offer executive search, executive coaching, and work psychology consulting. Please visit us at spiritmco.com, where we fulfill our clients' dreams virtuously. Enjoy your show.
Welcome back to the Leading Virtuously podcast. Today on the show, we have a brother from down in Texas. So excited to connect with you today, Neil. Answer our first question, which gets us kicked off. Who are you?
Yeah, first off, Chris, I really appreciate you giving me the opportunity to come on here and plug into your audience. I'm really looking forward to chatting it, and I think we have actually some common roads, right? With Tenet and some work you did in Arizona. So it's funny how the longer you do this, the more you find out that it's interconnected. You know somebody of somebody. So yeah, very excited. So a little bit about me. I'm a guy who spent the last decade in healthcare administration. Started in the academic medical space, and then decided to go try the for-profit health system space for a few years. So I did the Fortune 200 rounds, and then finally decided wanted to go back to the nonprofit. So currently, I'm back in Texas, and I'm with the largest nonprofit health system for the state of Texas, Baylor Scott White. So I work on multiple service lines, mostly in hospital medicine. So it's a lot of fun. So yeah, Chris, that's a little bit about me on the business side. Personal side, I'm a guy who's a son of immigrants to this country, and my folks came from India. It's one of those kind of success stories. They came with nothing and amassed a lot. And so it's kind of funny with my career. Growing up, I had really one of two health or career choices: either become a doctor or an engineer. Clearly, I'm neither. So, Mom, if you're watching, I'm sorry about that again. But yeah, so it was just a lot of fun, kind of going in that environment, and then I was this 20-year-old, and my goal growing up, when I was kind of in my young kind of figuring out what I want to do with my career, was I wanted to make $60,000 a year. That was my goal, and I had no clue how I was going to do that. And I think what I'd like to share a little bit today with your audience is it's all about zigs and zags. Your career path isn't necessarily from A to B. There's a lot of different jumps and hurdles that you have to go to.
So your parents, so tell us a little bit. So were you born here in the United States, and what were their careers like as well, Neil?
Yeah, so yeah, I was born in the Chicago area, so I grew up in Chicago and mostly Detroit. So dad actually in Detroit, he worked for Ford. He's has an automotive engineering background, and mom was on the auto insurance side. She worked for a call center, so came from fairly meager background. I'll just say that also growing up in Detroit, and I was a young adult during the Great Recession. Um, you know, when you saw kind of the collapse of the automakers, you knew everybody you knew was impacted by it. So I think that was also very transformative for me as being a young adult, and just experiencing the Great Recession directly on, in Detroit.
Hmm. Well, thank you. So so that kind of confuses me as to how you made the journey into the healthcare industry, Neil.
Yeah, yeah, absolutely. And what's even more confusing is my background. I'm actually a trained scientist, so this healthcare is my second career. So yeah, so I did the sciences track for a few years, kind of again, either become a doctor or an engineer. I trained and I went to school and did the sciences, and worked as a scientist for a few years at the works with the likes of Pfizer, the NIH. And Chris, the problem is this is for me, doing research and scientific work was just, it was incredibly boring.
Mm.
Um, you know, it was so methodical. Like if your day was off kilter, it was because a certain assay or blot leaked or something. There was like, everything was so planned and so, methodical. It just didn't rustle my spark of, like, a little bit of chaos. in my professional, day-to-day life. So it was kind of during this time of I'm transitioning. I didn't know what I wanted to do with my career. And interestingly enough, I kind of hit that 60,000 mark as a scientist. And, I'm trying to figure out like, what do I want to do with my life? And interestingly enough, when I was an undergrad at the University of Michigan, I had a startup company. And the startup company was just one of these kind of things that it was like a pre-Uber, pre-Lyft type of deal where my roommate and I at the time we just used our cars and gave rides to the student body in Ann Arbor. And the joke at the time was just let's just get some beer money and date money, but it just quickly amassed. We had like a whole fleet of drivers at the end of this. So I- having had that and experiencing that when I was an undergrad, kind of it sparked a lot of interest. It was like I really liked what I was doing. Now, of course, I had the whole bachelor's and master's in science, so it was difficult to like pivot into something totally different. But it was during that time of soul searching that a mentor of mine said, "Neil, you really should try healthcare administration. It's complete chaos. Your day to day is something new all the time. You have the business affinity with your startup company, and having gone through that, so why don't you look at healthcare administration?" So that's where I really kind of I started off as an intern, working as a front desk for a pediatric practice. So zigzag, right? So I mean, imagine a guy who is like a scientist making he hit his goal of how much he wants to make a year, and now he's like working at a front desk at a practice, checking in, checking out little kids for their pediatric visits. But it was just awesome. It was incredible, kind of getting into the healthcare environment. There was just so much need for disruption and opportunities to change things, and it really kind of sparked my I really like what I'm doing. So that's how I started off in healthcare, and that was about 10 years ago.
So that is one of the self-proclaimed titles that you have for yourself as a disruptive executive. What does that mean exactly, Neil?
Yeah. So it's funny, Chris. I mean, you, you look at the way we deliver healthcare right now, and we're doing the same thing over and over and over. I mean, there are a lot of emerging technologies that are really disrupting how we do things. I mean, the pandemic is proof positive of that. Even for large health systems, as the one I work with and have previously worked with, it's really challenged how we have to deliver what we do as a business. Um, and I think if there isn't that affinity to try different things or do something a little bit differently, it's incredibly difficult. So at Baylor Scott and White, we've done a terrific job for our intensivists and our ICUs. We've converted a lot of our ICUs over to a tele ICU platform,
Hmm.
and that's for ICUs because I work directly with our ICUs. But you know, um, overall, our whole ambulatory service arm, we were roughly around 6 or 7% tele pre-pandemic, and then we shifted to near 30, 33 or 34% during the pandemic, and we're continuing that stride. So, it's just if you don't have a sense of trying different things, change can be very difficult, and so it's been a lot of fun to like undergo those types of transformations.
So as you've made those transformations in a traditional non-tele world, what has been some of the pushback for those that are not willing to make those changes? Like how, and then also how have you overcome the people that have been resistant to change in that way?
Yeah, absolutely. So I think there's multiple layers of trying to get change. Fortunately, with the pandemic, it wasn't a case of people who didn't want to change. They had to change. I mean, there was no way around it. We couldn't deliver care without having to change. Um, so it started with our physicians and getting a proclivity for going tele and being comfortable with that, getting the medical leadership uh, bought off to say yes, we can deliver still our level of care at the same clip by utilizing this. And I say tele, but it is a bit of a hybrid. There is also some physical presence to our ICUs. It's just if it goes beyond a certain level, can you turn on this tele component? And then also the IT components of, can we utilize this with our legacy systems, with our electronic medical record system? Um, I would just say that, this environment has been really wonderful because I think what it's done is it's forced a lot of health systems to change rapidly. So I think, we're all kind of, it'll be interesting to see how quickly we run with other initiatives now as a result to say, we made this change very quickly. Now what else can we do in light of the pandemic? And I think a lot of organizations were looking at the pandemic as that crutch to change really rapidly.
Yeah, I think that it's disrupted a lot of different industries in many different ways. If you look at the restaurant business, there's so many restaurants, even as you drive through to look at my wife and I always comment about how many tents that you see up, and did many different restaurants even contemplate that that was going to be a thing, and how just the way that organizations have to be able to shift quickly, and if not, then that might be a lot of those organizations that are no longer around. And I know, at least for us in our industry, for just being able to show up via video chatting in the executive search and recruiting business has been actually a very big blessing for us, because previously most people would really push back heavily towards, like, I guess maybe the adoption rate would be like 40%, but the majority of people didn't like to go on video chatting. And now it's like, okay, like, we don't have a choice. You don't have a choice
Right.
anymore, because if you're not video chatting at work, I don't even know what you're doing at this point. So that's been actually pretty great for being able to get candidates to be able to connect with you in that way. And so that's been good for us. And I know that, so we're talking about the kind of theme of change. And pre-roll, Neil, you had talked about having to go through a layoff previously in your career. Can you maybe speak? So it sounds like pivoting has been one of those things that you've started to get pretty good at in your career.
Yeah, yeah. So I went into the academic medical space and progressively worked my way up. A few years into it, decided to go try the for-profits. So I joined a Fortune 200 company. They relocated me. I'm based out of Dallas, Texas. They relocated me to the Bay Area in Northern California. And they just needed a turnaround guy. So there I was, and I think we were doing a lot of really good work. We had grown our top line, I think it's like 22, 23% in on 1 year basis. And we were doing all the strategic right things. We were partnering with the right payers. Everything was going quite well, to the tune that the CEO, he runs the whole state, pulls me aside and he says, Neil, in the next couple of months, I want you to be my COO. I've already talked to the board, talked to my CFO. We see you in a higher leadership capacity. And he's like, I wanted to run that by you. Is that something you and your wife would be okay? I'm like, this is exactly, what I wanted to do. Progressively growing throughout my career. I mean, now you've hit the C-suite. I've hit a pinnacle. Coming from a guy who's said, I want to make $60,000 a year coming out of Detroit, it's a dream come true. So I was ecstatic about it. And at that time, there were some corporate restructuring. We had a new CEO come in who was active on the board, and was mostly in the consulting side, and he had a different view of how the system was supposed to run, and he was in that cost savings and cost cutting mode. And so it became one of these conversations where my CEO is telling me, Neil, I want you to be the COO. A couple weeks later, this transition happens. I get a call from him, and he says, I don't know how to break this to you, but we're going to be eliminating your job. And we're eliminating your job in 48 hours. And you're going to also have to eliminate some folks on your team. So it's like, yeah, talk about like having the rug pulled out from you. Um, and just it was shock in the beginning. Like, what did I just face? Like, here I thought, I'm, telling my wife I'm going to be a COO and all this good stuff, and we're planning and let's go buy a house, blah blah blah, and then all of a sudden you're without a job. And Chris, I was ashamed about it at first, to be quite honest, and I was able to bounce back. But what it also kind of taught me is You know, I to that point had only invested in Neil as the healthcare administrator. I didn't have a good sense of balance for Neil the person. If you asked me at that time, I tell you, Neil, I've got this MS, this MBA, FACHE, all these accolades I could list off, but I didn't really have much other roundedness of Neil the person because at that point my career was my identity. And so I think that's why it hit me really particularly hard. But that was also a very transformative event for me to say I didn't have enough balance on Neil the person, and I had too much invested in just my career without having anything else. So to answer your question is yeah, that was a very off kilter moment for me. Um, and I yeah, maybe do a complete 180 in how I evaluate both my professional and personal development. And I kind of have a silver lining because I'm in a great organization now. I was able to get back home to Dallas, Texas. We have family here. But funnily enough, also some of the folks that I had to let go in California have actually brought on here in Dallas, Texas. So it was just a really nice silver lining to have good people with you and being able to bring them over.
Yeah, I'm curious about that, Neil, because I would imagine as we look at the majority of our workforce and a lot of the baby boom generation coming off into retirement, as you talked about having kind of an identity crisis as getting laid off and having to fight through that of like, okay, well, here's how I identify who I am. And then all of a sudden you're no longer in that role. And how do you like actually work through that process to be able to kind of get yourself back into a good mental space to be able to transition from there? So just kind of curious as what did that look like for you to I guess make more investments into yourself as a person instead of just solely being so mindful about the career. And then now what does that look like today as well?
So it was a blessing in disguise, Chris, because at that point I never really evaluated what I should be doing as a person. I'm married to a wonderful wife, and but we were both kind of very hyper focused. We're both type A's only in that career trajectory. So I didn't have a choice to really, you know, develop that. And I think you're spot on because I think your point of baby boomers, those who are going to be making a tremendous transition as they, come to the sunset of their career, what are they going to do next? And it's funny, I look at the literature all the time on LinkedIn, and you'll see people say, "Oh yeah, have you thought about like signing up for a board or volunteering with your organization?" And I think about that, and I feel kind of bad about that because you're still kind of then you only identified yourself as that business administrator, in that particular niche of that organization or that industry. And I should hope that people have, spend enough time, or if they don't, they need to, is, identify what are your hobbies, do something totally outside of your industry. So to answer your question, things I have been doing more purposely is real estate. I love real estate. I've come to find that, it's something I truly enjoy. I'm doing a development deal with some family. We're doing a 60 unit condo that we're putting up in West Texas. Um, I really enjoy giving back to the community. There's a local organization here, Genesis Women's Shelter. They work with domestic abuse in the community, and it's been just outstanding or astounding to see just how bad domestic abuse has gone up as a result of the pandemic, but just contributing back to that organization as well, as they're opening up a new satellite for their services, and just trying to help them on the kind of professional services side on how, have you thought about this and this and that. So it's just rounding out of what are your hobbies and what do you enjoy doing. I think I told you offline too. Something I also started was Bitcoin mining. I had no idea. I was so intrigued by the whole DeFi community. It's decentralized finance, like cryptocurrencies and blockchain, and I've just been like fascinated by it for a few years. So had time to just kind of look into it and understand it, and I've started and got my own rig, and I started mining bitcoins.
Hmm.
Yeah.
That is I love that. There's three things that are very off the cusp and not related at all to one another. So
That's a construct of it, right, Chris? I mean, I would urge people to do things that are very separate from each other, especially if they're in the I don't know what I want to do. I have these broad hobbies. Do things that are totally, separate from each other. And, you may hit a home run, you may hit a single, or you may say, this is stupid. I don't ever want to do this again.
Mm, I love the way you, yeah, just phrase it that way. So, wanted to talk about specifically the nonprofit that you're getting involved with. How did you come across the organization, and what level of involvement are you presently involved with it, Neil? Just because as you're talking about, like, okay, so here's some of the ways that I give back to my community. I think that's interesting for, just inspiring other people to maybe do the same as well.
Yeah, so great question, Chris. So I would say, so how I approached it was the our local regional chamber of commerce. We've got the Dallas Regional Chamber of Commerce, which is a phenomenal organization. Dallas and Fort Worth. It's an actual regional chamber as opposed to just a city's chamber. They've been experiencing tremendous growth, as everybody knows. Dallas, there's a lot of relocations for people, corporate, et cetera, et cetera. Um, and they run a leadership program. So I was very fortunate to apply for that leadership program last year, and I was accepted. So this is actually part of it's called the Leadership Dallas program as part of the Dallas Regional Chamber, and I'm currently serving as one of the constituents for that Leadership Dallas program. So Genesis, the nonprofit I'd spoken about, is one of our projects this year. And so they are, like I said, they're launching a new satellite, and so we're just helping in the endeavor of how to put it up. It's literally they found an old AutoZone, and so we're giving them ideas on how to do the physical layout. They want to do some mental health services. So trying to see if we can team up on the health system standpoint, to see if we can bring some resources to them. And then also they're doing a large, they just have a thrift shop that's open to the public. Whoever has need, doesn't cost anything. And so we're taking donations across the community to help kind of build up their thrift shop from the ground up. So to answer your question, absolutely. I mean, I would say first thing is hit up your chamber of commerce. There's some tremendous resources there. United Way is another wonderful resource, and they're always looking at different individuals with different backgrounds to bring in.
Awesome. Well, thank you for sharing. And no, I love that. Looking at the way that the pandemic has negatively affected families, I think that's, being able to get involved to be able to help families in that way is an outstanding endeavor and mission to be able to help in that regard. And this podcast, as you know, Neil, is all about virtue and leadership. And that is in line with that on the basis of like giving your time freely to be able to help out, make an impact in your community. Definitely love that service that you're taking on as well. Looking at your own career, Neil, just kind of curious what virtues you're presently working on now in your own leadership journey.
Yeah, it's a great question, Chris. I think just mindfulness it goes a long way, especially in this environment. We're not doing enough of mindfulness and pausing to just think about the emotions that we're experiencing, not just us ourselves, but our teammates. It's a very salient point for me because I work with intensivists right now who are on the front lines of the pandemic, and you see that both the physical and the psychological toll that these individuals have experienced, and you can tell like it's been a year, and you can see kind of the physical attributes of what the weight on their shoulders have been. I mean, these people are making incredibly difficult decisions day in and day out. Um, so I think that's something that I haven't done a very good job, and that I'm actively working on. Is just mindfulness, and not just mindfulness for myself, but spreading that to my all my teams to say it's okay to take a pause and breathe, and just be human, and experience, and understand how you're feeling and why you're feeling what you're feeling. Um, because I think that if we don't do that, it can manifest in a very poor way. especially in this day and light and what we're all experiencing right now with the pandemic.
Have you experienced any of those, um, I guess, negative outbursts from not being mindful and not taking care of yourself during the pandemic? I remember for myself, I kind of just like got to this place where I was like, you know what, we're working remotely and we're going to just double down in our efforts and just remember like one day just like not really experiencing the pain of just like the change and just crying into my hands like in the kitchen one day, just being like, I'm so sick of this, like, just so frustrated with the way that business was downsloping and all that stuff. So yeah, just kind of curious of how that has maybe played itself out for either you personally or just some of your teammates of just being stressed out and frustrated with having to deal with the pandemic.
Absolutely, Chris. I think, what you experience is absolutely human, right? If you're not experiencing that, I, I would be more concerned, right? If you're not having an outburst in this environment, um, you know, either maybe you're not as impacted really well, or maybe you're doing like everyday meditation, so it doesn't even phase you. I don't know. Maybe you've got the Headspace app on your phone. I don't know. Which big plug for that. That's a really great resource for people who haven't utilized that or calm. Some wonderful resources out there. Um, but to answer your question is, yeah, with our teams, I try to create an environment of it's okay to have an outburst. It's okay to have an outburst that's contained amongst us, and I'm guilty of it too. I mean, my team knows it. They say, "Oh, Neil's cranky." So, I wear that sometimes. If I'm a little tired, or I just want to get to the point, or getting a little bit agitated on a response, they can see that and they can sense that. The beauty of that is I have a feedback loop now, because I have the trust of my team that they can tell me, "Neil, you're cranky," and that's a cue to, like, okay, I'm not exhibiting what I need to exhibit as a leader. It's time to, it's a gut check of change the way I'm portraying myself. But it's so important to have kind of a session where you can have closed conversations as needed with yourself, your team, with your family, with anybody who's close. I think that's so important to have those resources. It doesn't even have to be family members. I mean, I love talking to perfect strangers. I mean, there's a reason why people talk on the airplane all the time, right? It's just sometimes people just naturally, have things to talk about. So I think, you know, people should find all the avenues that they have to, you know, take that out when necessary in a controlled environment.
So what you're suggesting is we shouldn't just blow up in the middle of patient care and
No,
in front of customers. Yes, yes, good point. But yeah, I love what you're stating there too of being able to, from that place of mindfulness and being able to, talk through that and allow your teams to recognize that you actually prefer and look for them to be able to be a feedback loop and give them the safe space to be able to share that feedback with you too, that you're able to like just grow and develop in that way instead of just being cranky Neil and everyone's just like, man, what's his deal today. And no, I yeah, because I feel like in the same way I kind of have the same feedback loop with my wife, because we work together and we raising two boys together. And in the same way, like she has kind of like just knows when it's like, hey, maybe it's time that you take some time out to just go spend some alone time and recharge those batteries. And I think sometimes as like this pseudo introvert extrovert, that if I'm around people for too long, I can get the same way where I'm just feeling like I've lost that creative ability to be more strategic in the way that I'm communicating instead of starting to show some of those emotions. And yeah, that's very helpful to be able to have that feedback loop and pull yourself out when you know that I've hit a wall here.
absolutely. I mean, Chris, I imagine you are constantly in contact with people, and that can, again, especially you said about introvert extrovert, that can be very wearing on you too, right? So having that feedback loop with your wife is definitely incredible to have, and it's important to have that. And I guess for the listeners and anybody out there too, is if you don't have that, figure out who those people are to have some type of feedback loop. Because if you don't have that, you're exhibiting the frown face the whole time, and that's never a good thing for a leader.
So Neil, you also brought up the another thing that I wanted to talk about a little bit was it sounded like from a very early stage of your career you had a mentor. Not a lot of people have the opportunity to have that privilege of someone that is specifically like pouring into them for their own career growth. Can you speak to how that originally came about and maybe just kind of like your journey into having a mentor and then also maybe being able to pay that forward too.
Yeah, it's incredibly necessary to be successful. I can't think of anybody who was successful not doing that. Something great by themselves. So let me kind of decompartmentalize that. So in terms of finding a mentor, I always took the spray and pray strategy, which is I contacted a lot of folks and I just saw who would respond back, and then from there it's just can you go grab a cup of coffee, and then you strike your balances. You find if there's good chemistry or not. I would say that some of the best mentors I have are people that I can go grab a beer with and talk at a very personal level, not just at a professional level. Because everything there's a blur of both. I mean, you have to be able to have both a professional and a personal, and having a mentor who does the same and reciprocates at the same level, I would say is very important. So that's something I strive for. So yeah, I've been very fortunate. I think I just have very good luck, knock on wood. But just had some wonderful mentors, and I think also as I've grown up and developed, I'm very mindful of who I work with. I want to be extra sure that that's somebody that I can learn from, and I'm going to give them 110% of my efforts. So I think also being conscious of exploring those right people. Don't just take a next opportunity because it's a great you know title or pay or whatever. Be sure you're mindful of is there these teams that you can work with. Are there people who you can look to as a mentor, and then also below you who you can mentor. Which goes to the last part of your question is, yeah, paying it forward. So I've had one really wonderful mentor, and he's the one who actually persuaded me to try healthcare administration. An administrator, a guy named John Barry. I don't know if John watches this. John, this is a plug for you. Wonderful guy out of West Texas. It's funny, he's got a West Texas drawl. So I'm not even going to try to do his accent because I would be doing it a disservice. Maybe if I can find some dip, I can maybe imitate it a little bit, but we won't do that. Um, no, it's just I've been very conscious about bringing in people and ensuring that I can form a relationship with them and have them grow in the organization and grow as a person as well. And it's something I've actually been very excited about as I've developed my professional career. It was in the beginning. It was, oh, let me go increase my P&L and let me go increase my scope and how many physicians I employ and blah 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 blah. It's changed now. That's still somewhat important, but it's not what I really enjoy. What I really enjoy is how did my direct reports grow within the organization. You know, did they say something or initiate a project that I'm like that was brilliant, like that to me is now the new measure of success. And it's just something that's been a lot of fun to be a part of others development around me as they grow within the organization.
Hmm. Yeah, just kind of curious why the shift with that, Neil? Because I think that probably is a trap that a lot of people fall into, of being too focused on kind of the prestige of leadership instead of what it needs to be about, which is the people that are under you and how you can bring them along with you. It's interesting. I was watching a John Maxwell talk today on leadership, and he was saying that one of the things that he said was that if you ever hear people say it's so lonely at the top, then that means that they're a hiker and not a leader because
Yeah.
leaders are those that bring others along with them. And so, yeah, just kind of curious about that shift in your own leadership approach.
So I think it was my humbling moment where I lost my job, because up to that point, my philosophy was deliverables and making more deliverables and making those deliverables look even better. Um, it
That's
was
an
that
ending.
humbling moment, man. It was that humbling moment of, okay, you thought you were all that, and then some, and here you were going to be a COO, and now, you got to go get unemployment. That'll humble a person very quickly. And I hope that never happens to any of your audience members, because there's a lot of toil in that. But for me, this may say a little bit crazy, sound a little crazy, but I think, had I had the opportunity to go through that experience, or not go through that experience, I'd choose going through that experience, because it changed my perspective on how I view leadership, how I view, myself, and how I view both, professional and self development, and as that contains to or pertains to team development. So yeah, it just, it was very difficult for me to, here I am, I'm losing my job, and I've got to go eliminate, X number of people and have the same conversation with them. But I remember one thing that struck with me is, I don't want you to feel alone, because I'm in the same boat with you. We're going to get out of this. And it was so cool for me to, you know, take some of those people to my current opportunity now, and now they're gainfully employed, they're flourishing. That was a very transformative event for myself.
Yeah. I could definitely see how that, I mean, just having to let people go in my own career and being able to say like, hey, look, we're right in the same boat. I've never had to
Right.
do that, but I can imagine how that would soften the blow and make the conversation that much um, just easier to be able to have with those individuals too. And yeah, full circle to be able to see them grow and flourish from that is incredible too. So thank you for sharing, and thank you for your humility to be able to share that with our listeners today as well. So Neil, just absolutely love the journey that you're on, and the growth that you've been able to exude in your career. How can people get a hold of the work that you're doing at Baylor?
Yeah, absolutely. So you can find me on LinkedIn. Sure, my name, first name, last name, will be in the topic, but you can just look me up on LinkedIn. Please connect. If other people are in similar journeys, or have any troubles, please reach out to me. I'm happy to connect, or see if we can come up with something. Other side is, I do have Twitter as well. Um, Twitter handle is NDPITHAD. Don't expect a whole lot of healthcare. There's a lot of like real estate, Bitcoin, and wines and cars. So most of my hobbies.
Awesome. Well, thank you for sharing. We'll also have both of those links in the show notes as well. And thank you so much for being on the podcast. Looking forward to the way that this blesses our audience as well. So thank you for sharing, Neil.
Outstanding, Chris. Thank you so much for the time.
Yeah, no worries. Hey, Chris here. Hope you enjoyed the episode where we discussed all things going bald. Just joking. The Leading Virtuously podcast. If you enjoyed the episode and the podcast, will you please subscribe on YouTube or Apple Podcasts or Spotify? Or you could also share it with a friend. That would be tubular. I hope you have an awesome day.